Hello everybody, let's talk about elastography. So elastography is a new technique that is developed lately in the ultrasound field and is aiming at evaluation and display of tissue stiffness. So what is tissue stiffness and what is elasticity? Elasticity is the opposite of stiffness. So if I'm talking about elastography, which is more or less related to the elasticity, I am, in the meantime, I'm checking on the stiffness because they are the two extremes of the same criteria. These are like the two sides of the same coin. If I'm having high elasticity, I will get low stiffness. And if I'm having high stiffness, I will get low elasticity. So these are the two extremes of the same criteria. Elastography has two types, the strain elastography and shear elastography. So before talking about the two types of elastography, we need to know some terms here. The first term is stress. What is the stress? Is a force of or pressure that's applied per unit area of a medium. So if I'm having a medium and this medium here, I apply some stress from outside. So there's a stress that's applied here. So this is the stress. Based on this stress, there's some changes that happen in the medium here. We have two changes. One is called strain, and strain that we have here some waves that happen in the same direction of the stress. These waves happen in the medium, but they are as a response to the stress, and they are parallel in the same direction, parallel to the direction of the stress. So this is the strain. So what is the strain? Some particle displacement that happen in the tissues, but this, or in the medium, but these particles happen in the same direction of the applied stress. On the other side, in the same medium, we might have what we call shear. Shear is shear movements or shear response. These some deformation or particle movements that happen in the opposite direction. So they go perpendicular to the stress. So I'm having a stress, and this stress will cause changes or particle displacement inside the medium, and these two changes are the strain and the shear. And these are the one that elastography is using. Elastography is either measuring the strain or measuring the shear. Something here that we need to know also as like a term is what you call elasticity modulus or Young's modulus. What is this? This is the ratio between these two factors, the stress and the strain. So it's the ratio between the applied stress to the induced strain. This is the elasticity modulus or Young's modulus. So first type of elastography is strain elastography, and it sometimes is called static elastography or quasi-static elastography because these terms are related to the force applied or the stress force that's applied. So how this technique is done, how the elastography or strain elastography is performed. First, the operator using the probe will apply some pressure over the tissues. So we're having here a force that is applied on the tissues. This force will induce inside the tissues, will induce what you call strain waves that are parallel to the same direction. So these strain waves are caused by the applied force. And the force here sometimes called the static force or the quasi-static force. That's why elastography is called static elastography or quasi-static elastography. What happened by this force? We get strain waves. Strain waves are parallel to these waves and they are running in the same direction. So on the other side, the ultrasound system is ready to take some data before compression, and they are called the pre-compression data. And these pre-compression data are kept inside the ultrasound system. And then when you apply the compression by your probe, the machine will take another set of data which are called the uncompression data. Comparing these data together, the machine can depict or calculate that there is some displacement, tissue displacement, and this is the one that the machine is displaying on the screen, the tissue displacement. Okay, examples. If I'm having here a soft tissue, like any soft tissue, our muscles, thyroid, all these are soft tissues, breast tissue, they are soft, okay? So they have more displacement. Stiff tissues, like for example, malignant tissues or bone or whatever, they are having less displacement. So according to this quality of the tissue, the machine can tell that there is more displacement or less displacement. How this tissue displacement in strain elastography is displayed. Okay, there are two types of display, either in the grayscale display, okay, or the color coding display. Okay, so in the grayscale display, if there is a dark area, it means that this is stiff. So stiff areas are dark, like here. This is stiff area here. You see it's dark. Okay, and if there is brighter area, that means that it's soft. So have here some brightness around it or not that dark. So these are compared. I'm having here soft tissue and there is here stiff tissues. This is by grayscale. If I'm using the color, okay, the same area that is dark, it will show blue. So blue color, it means that this is stiff. The area that was a little bit soft, it will acquire some red or green. So these are red or green. They are representing the soft area. So again, stiff dark or blue. Soft will be brighter or green and red. Another example here, this is a soft area. So soft area here is bright. So this bright area is soft, okay? And it acquires a red area here. So soft area, this is acquired as red or green. So I don't have here hard area. This is totally soft. So by strain elastography, we can tell that if I'm having a benign focal lesion or malignant focal lesion, what are the difference in display? Benign area is texture is soft, and by grayscale is brighter. By color, it will take red or green, and usually it might be underestimated if you talk about the size. On the other side, malignant areas usually they are stiff, and that's why they acquire the darker area if you talk about grayscale, or if I'm using the color, they will take the blue color, right? And many times there is overestimation of the size of the lesion or the focal lesion by using the, if it's malignant, by using elastography. So sometimes elastography might overestimate the size of malignant tissues. So the second type of elastography is the shear elastography, and it's another technique. Actually, it's more recent technique compared to the strain elastography. And here the force, we have a force that is applied to the tissues, and we have shear waves. And as I mentioned earlier, shear waves are perpendicular to the direction of the force. The force here is different from the strain elastography. The force here, okay, if you talk about the technique, okay, there's a dynamic force. It's not static force like we mentioned earlier in the strain elastography. We call it static because it's manually applied, but here it's dynamic force, and that's why the term or the another synonym for the shear elastography is called dynamic elastography. Dynamic elastography, why? Because the force here is different. What is this force? It's one of two things. Okay, the ultrasound probe in this system is the main source of this dynamic force. It's either sending a strong focus ultrasound pulse through the tissues, and this will be acting as the dynamic force, or sometimes some ultrasound probes are implemented with some uh, vibrating technologies that will send a repeated set of waves of vibrations through the tissues, and this is again the dynamic force. So the force here is different compared to the strain. Strain, the force is manual compression by the probe. The shear elastography is using one of two techniques, either a focused ultrasound pulse across the tissues, or a set of vibrations by certain technology in the ultrasound probe here that is using these vibrations. Either way, okay, I will get shear waves. Shear waves are perpendicular, and these are the one that are detected by the ultrasound system. They are known to be slower in propagation compared to the strain waves. Strain waves are rapid and going straight. Shear waves are slow and going in a perpendicular way. So now what happens in the ultrasound system after this focused ultrasound pulse or the vibrations are transmitted through the tissues? Okay, I get shear waves. Now, what the ultrasound system is doing? Ultrasound system is sending repeated ultrasound pulses that can detect the shear waves that are created in the tissues, and through this, it can track the shear waves with multiple sound pulses. What happened now? Okay, they are exposed or they are displayed in color. There is no gray shade display in the shear elastography. It's only bicolor display. So with elastography, whatever the type is, strain elastography or shear elastography, what are the clinical applications that are using this technique? Okay, this technique might be, as some books write down, that it as if you are palpating the tissues. You can tell this tissue is stiff or soft using imaging. That's why sometimes it's called palpation by imaging. You can tell the, the texture of the tissue on the screen, and that's the main job of elastography. So what are the clinical applications here? It could be used or currently is used in breast scanning, thyroid scanning, liver, and this is mainly to detect cirrhosis of the liver, or prostate tumors, and a lot of other applications. This technique or this technology is getting more popularity in the ultrasound field. So again, it has a lot of applications in the ultrasound field. So here is some sort of comparison between strain and shear elastography. Okay, you can pause the video and or you can take a screenshot of this and keep it. This is a comparison chart between the two technologies, okay? And you can read it on your own. I just put it here for you guys if you want to have a print. Thank you and see you later in another video.